Sir, you told us that the Botox is also used for to unmask the underlying spasm.
The Botox is used both as a treatment and as a test. So if you think problem is in the knee but not in the heel, then you inject the hamstrings, or you do, as Sufyan said, do an anesthetic examination under anesthesia, and you will know which joint is the problem. So, but also Botox is used for permanent treatment. Okay.
Okay, sir. Botox is also, I read in a book, it is also used to delay the surgery.
Yes, because if you can passively correct this without actually
you are doing.
So if you can passively correct this with an injection without surgery, then it will work. But Botox has got a time after which it will not work, because the Botox works on the neuromuscular transmitters, isn't it? At a certain stage, it will not work.
Okay, sir.
Is this useful at all, or I'm just doing this? Okay, so gait cycle. Okay, so let's start the gait cycle. I've got so much stuff on my computer; it just keeps crashing on me these days now. Let's do the Botox, the gait cycle, and then we can wait for the guys to come in to do the soft tissue knees. Yeah. Okay, so the whole idea for the small, short description on gait cycle is that you'll be able to know what a gait cycle is. You need to know what are the different phases of the cycle. You need to know the different types of the gaits and different pathologies, and then you need to be able to measure them. Okay, they're very simple and very easy to understand. Okay, so it is a lab test, basically. That's what it is, and it is telling you what is normal and what is not normal. And before you can interpret a test, you need to know what are the different components of a test. Okay, so the normal gait definition. Does anybody want to tell me a definition? Don't read for me and tell me what you want to do. Yeah, what's a gait? Anybody? So it's a force or a motion which makes you go from one place to the other, isn't it? That's the simplest, commonest definition. It is a process by which you move from one place to the other, and that's what a gait is, isn't it? So there's a lot of words here. I mean, rhythmical, this is a book definition. This is rhythmical alternating movements of the trunk and limbs which results in forward progression of the center of gravity of the body. So basically, you are using your trunks and your limb to move and progress from one place to the other. Okay? So if somebody asks you a definition in the exam of a gait, what would you say?
It is a series of rhythmical movement of the trunk.
You don't read this. It is a series of movements which causes the body to move and progress from one place to the other. Yeah? Keep it simple, always simple, so that you can remember it. Okay, don't read books definition. Book definitions are always difficult, and they've been modified so many times. Okay, it's a rhythmical movements which allows you to move your body from one place to the other. Okay, simple definition. Okay, and the gait cycle, it is a single sequence of one limb. Okay, when initial contact starts and when it leaves the contact of the same foot, that is what a gait cycle is.
Yes.
Okay, so when you have initial contact of your right leg, and then when you come back and have an initial contact of the right leg again, the whole process from the initial contact of the right leg to having the initial contact of the right leg again is called a gait cycle. Is that simple? It is a difficult topic, so I'm going to keep telling you to remember and remind with me or repeat with me so you can understand. Okay, so gait cycle is, anybody, I don't mind. What is a gait cycle?
This is a single limb movement from the.
So we know that it's from the initial contact
of function of
the same limb to another initial contact, the same limb is called a gait cycle. Okay.
Yes.
We're happy with that. Okay, and this is basically various things that happen in it. So the way to describe this is there is a stance phase and there is a swing phase, and then there are variables that you have to measure. Okay, so for a normal gait to happen, you have to have an upright position, and you have to have head, arms, and trunk working for you against gravity. Okay, and you have to be able to maintain your balance, and you have to have good foot control. Okay, so to have a normal gait, you have to have your head, arms, and trunk to work against balance. It's called hat against balance. You have to have stability, and you have to have good foot control. Okay, and as you already know, there is a gait cycle that's got a stance phase and a swing phase. The stance phase is longer than the swing phase when you're walking. Okay, it's reversed when you're running. So the components are: you have an initial contact, you have a foot flat, you have a mid stance, then you have a heel off, and then toe off. These are called initial contact, loading response, mid stance, terminal stance, pre-swings. Unless you keep repeating this yourself, you're not going to remember this. So it's a good thing we have it on a video. You can keep looking at it. Okay, so you have a stance phase, and then you have a swing phase where you move your toes from the toe off position to finishing and decelerating. That's the swing phase. 60%, 40%. Okay. So the stance interval between this process of standing and then standing again, you have a condition where you have both feet on the ground, you have one foot on the ground, and you have another position where you come back again to both feet on the ground. So you have both feet on the ground, you move, you put one foot off the ground, so therefore one foot is left on the ground, and you come back again to have both feet again on the ground. That's the stance interval. Okay. So we have already done this, but I'm repeating this again and again so you remember. Stance phase 60% and swing phase 40%. So in the stance phase, the limb you're looking at is in contact with the floor. The swing phase, the limb you're looking at is not in contact with the floor. We're not talking about, so if you're talking about right limb or we're talking about left limb, the stance phase and swing phase is of the right limb if you're talking about right limb. Not looking at the left limb. We're only now looking at one limb. So we are looking at one limb. When that limb is in contact with the floor, it's a stance phase. When it's not in contact with the floor, it's a swing phase. Okay? And again, you need to understand that at one time you will have both feet on the ground. At certain times you will have only one foot on the ground. Okay? So the stance phase is divided into 5 different components. Okay? Which means the initial contact, where you actually put your foot on the floor, from it's mostly the heel, but it is whatever touches the ground first, and then the foot becomes flat. It is called the loading response. Okay, and then the greater trochanter is vertical with your heel of the foot. That's the mid stance phase. Okay, so you have initial contact, you have a loading response. Then when the trochanter, greater trochanter, is in alignment with the back of your heel, and then the heel comes off, and then the toes comes off. Okay. So remember, you have initial contact, okay? Then the foot becomes flat, which is a loading response. Then you have a mid stance where the line drawn between the trochanter and the back of the heel is in the same plane. Then the heel comes off, and then the toes come off. Is that easy to remember? Stance phase?
Yes.
Yes, sir.
Yes, certainly.
Okay, the slides are going to be there on the video, but you need to understand that the stance phase is divided into different components. And it's basically you put your foot down, it becomes flatter, it becomes stronger, then the heel comes off and the toe comes off. Okay, so that's the stance phase. So basically you're in contact and coming off contact. That's the stance phase. Okay, in the swing phase, once the heel's off, the toes off, sorry, it will move in what is called an initial swing. Then it will overtake the other limb in stance. So the limb that we're not measuring is still going to be on the ground, while the other ones, otherwise it won't be stable. We have both feet off the ground. So in what condition do you have both feet off the ground?
Running.
What is the condition where you have both feet off the ground?
Running.
Sorry? Did somebody say running?
Yes.
So in running, both feet are off the ground. Okay, that's the only very small stage where you have both feet off the ground. But if you're talking about swing phase, the other one is on the floor. The one you're looking at has got a starting of the swing, then it overtakes the other leg that's, so if you look at this picture, this is in swing phase. Can you see that? And it's going up there and it's moving across to the other leg that it is standing. It's moving beyond that. And then it slows down to have initial contact. So the swing phase is smaller. It's 40%, therefore it's got less components. So what it does is you have lifted your toe lift here, yeah? Your toes have come off the ground. So you go into initial swing. And the leg then swings forward until it crosses the other side and then is getting prepared to land. Okay, so that's your swing phase. Is that easy to understand?
Yes, sir.
Okay, so you're all very quiet. It doesn't mean that I'm only saying this and you don't understand. You know, I need some response. For me to know that you understand is you tell me. If you don't understand, we'll keep going through this until you understand. So we've put the stance phase into 5 components, right? You put your foot down, and then when you put your foot down, it becomes flat. Then the trochanter comes in line with the back of the heel, then the heel lifts off and the toes come off. Okay. So that's your contact phase. In the swing phase, once the toes have come off, it swings to go and cross the other leg, which is already on the ground, and then it starts to slow down so it can come down and become initial contact again. Is that understandable?
Yes, sir.
Yes, sir, it is clear.
So at the end of this, I will ask all of you to repeat this with me because I want you to know this. I don't want you to just go through this and telling me yes, sir. Like, okay. So when we finish, all of you have to repeat this stance and swing phase to me.
Sir.
Okay.
This is a good thing.
Is what?
Yes, sir.
Okay, good. So we know that stance phase is 60% and swing phase is 40%. The reason it's being repeated repeatedly is because I want you guys to understand that this is what you have to remember, okay? So you must also remember there is a single contact and a double contact. Okay, what does that mean?
Single, sir, means contact of one limb to the ground, and
Yes.
double means contact of both limbs to the ground.
So what part of the gait cycle is this going to be in?
Stance phase, sir.
Very good. So we know that 60% is stance phase when you're walking, okay? And of those walking time, 40% of the time of the gait cycle, which is 2/3 of your stance phase, is going to be single support. One leg is going to be supporting you, okay? If you have double leg support, which means both legs are on the floor, then you're not moving anywhere, you're standing, isn't it? And therefore, 2/3 of the time in a stance phase, you have a single leg support, and about 1/3 of the time you have a double leg support, yeah? The only time when both legs are off the ground is when you're running very fast, okay? The only animal that has got a longer off the ground swing phase is the horse. So when the horse is running in gallop, it has all 4 legs off the ground, okay? Which is very, very typical of the horse. Nothing else can do that. So when you're walking faster, the stance phase will become smaller. Is that clear?
Yes, sir, clear.
Yeah, so if you're walking faster, the swing phase will become more. You will have more time off the ground than you have on the ground. Okay, so it actually reverses it. 40-60 becomes 60-40, right?
Yes,
and
sir.
if you're walking faster, the double phase support also decreases. Okay, this makes common sense, but you need to understand this. The faster you walk, you have less stance phase, more swing phase, and less double support phase, yeah? Okay, so by definition, running means that you're walking without double support. In no time when you're running will both your feet be on the ground at the same time. Okay, and the ratio of the stance and swing reverses, which we've already understood. Okay, and double support disappears and double swing develops. Do you understand that line?
No, sir.
Yeah, double swing develops means both your legs are off the ground. There is no time will you have both legs on the ground, which is what is normally you see in walking. In walking, 1/3 of your stance phase, both legs are on the ground. We've discussed that in the previous slide, yeah?
Okay, sir.
So we've discussed that in 1/3 of the time you have both legs on the ground when you're walking. When you're running, 1/3 of the time you will have both legs off the ground. Okay? So that's why I said by definition will tell me that gait is 60% off the ground and on the ground and 40 off. You have to modify it by saying in walking, because in running it totally is opposite. Okay, so we have to understand various things, the distance variables. Okay, it depends on the step length, the stride length, the width of the walking base, and the foot angle. I will explain all these things individually. Like, okay, so what's a step length? A step length is how much you will walk. Okay, so which means that it is a distance between when one heel moves and comes back again to the same point. That's called a step length. you understand? A complete swing and a stance space together for both leg, for one leg is a step length.
Yes, sir. I think we can also say that is the distance between the initial contact of two alternating feet, sir.
That's absolutely correct. That's absolutely correct. That's even a better definition. Like, okay, so the stride length.
So stride length is the distance in the gait cycle between the initial contact of the same feet.
Yes. So what is the difference between step length and a stride length?
Sir, stride is actually 2 steps.
Yes, so it is double your step length. Okay. So whatever one leg is doing is a step length. Whatever both feet are doing is your stride length. Okay. So it's double the step length. Okay. So that's the second definition. The third definition is the walking base. Okay. And it is the distance between the two legs when you're walking. So remember, we said the children walk with a broader gait. The cerebral palsy patient walk with even a broader gait. But when in adults, you're measuring the distance between your 2 feet. That is called the walking base. How far wide your feet are being put on the floor when you're walking. Okay. So the examiner can ask you what's a walking base or what's a stride width. It is the distance between the two legs when you're standing between the heels. Yeah.
Yes. And sir, this distance is measured between the two medial malleolus, sir?
Heel. Always heel.
Two heels.
Yeah.
Okay.
But if you don't have heel contact, then it is the two malleolus, yeah? Okay, and then the degree of toe out. Remember when we said that certain disease disorders which are related to the brain, they cannot walk in a straight line. The normal angle for most people is about 7 degrees when they're walking in a straight line, okay? And as the faster you walk, the less you have out-toeing. So these are the 4 things in the definition that you need to understand when we're talking about distance. Okay, so the distance has got 4 definitions you must remember: the step length, the stride length, the width, and the foot angle. Okay, so not you, Satish, but can somebody else please tell me what is a step length?
Step length is the length between the
Length between the 2 feet is a step length.
So it's from initial. It is when you have a heel contact and you have a heel contact again. That is called a step length of the other side. Yeah. So if you are contacting the same leg, then it becomes a stride length. So did you understand? One full stance and swing face is a step length. A double swing and stance face for the same length to come back again is a stride length. Okay. Unfortunately, you have to understand this because these are the things on the gait cycle they will ask you. Nobody will ask you, well, you have to have a clinic, then you have to describe, but you don't have to tell all these things. But when you have a clinical patient, that's different. But on the table, if you have gait, then these are the definitions that you have to remember. Okay. So, and then we know that the feet are apart. We know there is a certain distance between them. And we also know that they extol about 7 degrees or into when they walk. If you have cerebral palsy or a problem with the brain, then they cannot do a straight line walk, okay? So that's the distance we're talking about. Now we talk about time. So we need to know something similar, but with time involved in it. The step time, the stride time, the stance time, single limb time, double leg time, swing time, cadence, and speed. We've already discussed this before we've come here on the various forms of the gait cycle, but these are things that you can come back and look at it, but these are things you have to remember for your exam, okay? So step time is?
Sir, it is time taken by the foot during the single step.
So it is the time between the heel strike of this one leg and the heel strike of the other leg. Yes. Okay. So remember, initial contact of one leg to the initial contact of the other leg is the step time.
Yes, sir.
So stride time is when both of them have done everything. Is a time taken to complete all that. The gait cycle and the stride duration time is the same, always is. Okay, I know it's difficult, and I know it's very, very difficult to understand. But the whole idea is, I show you today. You keep on repeating this all the time until you get it so right that on the exam you remember. That's why it is important to keep telling and talking about these things. That's the only way to pass exams. Okay.
Yeah. It was actually difficult, but you have made it very simple for us, sir.
Yeah, but that's the whole idea. I want you guys to pass because the exam is very unfair. I've really fought with the exams where the theory MCQs went out, the theories paper went out of it. It's taken me 2 hours of struggle to make the theory paper come out of the exam because it is totally unfair. The theory paper is totally unfair. And thank God that it's come out of the exam. But a lot of people helped, a lot of big names helped in it, but the theory is now gone. So, which means you guys are one of the lucky batches that are doing exam which is easier. So therefore, you should not disappoint me by not. We should all pass exam. You must remember.
Yes, sir. Thank you, sir. Thank you,
Passing
sir.
exam is easy.
Remember in prayer.
Sorry.
Remember in prayer, sir.
I remember everybody in prayers. You're like my children. So exam is passing is easy. Failing is difficult. You have to make a stupid mistake out there. It's exam to fail. Everybody knows everything. It's just the fact is you don't revise and you don't keep telling each other. Exam on the day of the exam, you have to repeat something that you've already practiced millions of times. Okay? That's why people in our part of the world pass, because we do this all the time. We go to the clinics, our examiners teach us repeatedly until the day of the exam. We're just ready to pass the exam. Okay, so we know what step time is. We know what stride time is. Okay.
Yes, sir.
So we know what stance time is. It's the amount of phase where the leg is on the floor. Yeah. And we know the amount of time the leg is off the ground. Okay, we've said that. Okay, and the stance time includes both single support and double support. Okay, single leg time is the amount that a leg passes one complete cycle. Okay, and the double leg time is when both feet are on the ground. So cadence, this is something different. We've not done that. It is a number of steps you can do in a minute. Okay.
Yeah.
And velocity is the distance covered by this body in a time. So we don't understand velocity, isn't it? So the faster you are, the faster your speed is, and the faster you are, the smaller your cadence is. Do you understand that? So if you're walking, it will take you 100 steps to reach a meter. Yeah. If you're running, it may take you 50 steps to get a meter. Yeah. Because you're doing it quickly, like isn't it? You're not doing more steps. You're doing less steps to get more distance.
Right, sir.
I advise you, I know it is difficult, when you are bored and you can't do anything at all, just look at this video again and these slides that I've shown you, keep repeating, remember it so that you can remember all these things, okay? Do you know when your exam is, the practical exams?
Yes, sir.
When?
From 1st April.
So it's plenty of time. We've got loads of time. We can practice quite a lot. I mean, unfortunately, I can only get free on weekends. Most weekdays I'm working, but I still try to do some WhatsApp teaching. But this is the best time. We'll do it Friday, Saturday, and Sunday, and we get to cover.
Okay. One question, sir.
Yeah.
Sir, when one person is walking normally, other person is running. So what will be the difference in the cadence of these two persons?
When you're running, there'll be smaller steps. So you have less steps to get where you do when you are walking. When you're running, the steps will be less.
Okay.
Okay, so we have a small summary here. The normal gait we know, the gait cycle we know what is the stance phase and what is the swing phase, and we know that gait is divided into various functions, and we also know that there are various components of each of those gaits that we have just individually looked at. Okay, so now abnormal gait. So this is what you will get in your clinical exam. You will get a person and you will assess and clinically examine it, and then you have to describe the gait and say what is wrong with the person, okay? So most common gaits you get in the exam is an antalgic gait, okay? A waddling gait and a Trendelenburg gait, okay?
Yeah.
But we will go through all of them bit by bit to understand. I won't go into detail a bit because it will take ages. This is just to get you the basic idea. So you have a lot of patients with neurological gaits, cerebral palsy patients, and ataxia patients, and other patients. Okay, you will have patients who have got problems with muscles, either they are torn or they've got a polio deformity or something like that. Then you will have people who have got either a short or long leg. That different discrepancy will give you a different gait. Then you have people who have got either arthritis or various other problems, and then you have a painful gait. Okay, so these are the 5 main components of it, but basically they're all the same thing. It's just that we've divided into 5 different components. Okay, So we need to know and understand where the problem is, and the leg length discrepancy, pain, and arthritis are the common ones you will get in the exam. Okay, let's go forward. Okay. So if you have an equinus gait or equinovarus gait, then you will have a leg that is longer than the other side. Yeah. So we'll have a leg length discrepancy gait. What does a leg length discrepancy gait normally present itself like?
Usually with equinus gait, sir.
Yeah. So the heel will point down, the knee will flex, right? And the hip may flex also to get your length if you're longer. If you're shorter, then the other side will be doing all these gaits in there. And basically what you're trying to do is you walk with what is called a waddling gait. Yeah, you're trying to swing the leg off rather than trying to follow. Okay. So an intalgic gait, what is the classic feature of an intalgic gait?
Sir, it is a painful gait, and in this gait the stance phase is very much reduced.
Why?
Because it is painful, sir.
So you want to take the leg off the ground so it's not painful. Is that correct? So you have a stance phase which is reduced, so that they have short, shuffling gait. Okay. So what will be the cadence of an intalgic gait?
Increase.
I think it will be increased, sir.
Absolutely correct. Absolutely correct. Because if you take 20 steps to get a meter, and if you are painful, you want to get off your stance phase quickly. But if you get off your stance phase quickly, your swing phase will also cause you pain. You put your foot back down again. So you have more steps to get to the same place because you're shuffling and you're having a short stance gait. So in an intalgic gait, you will have a cadence which is bigger than a normal gait. Okay?
Okay, sir.
So there is a condition where the hip bursa is inflamed. It's called a psoriatic gait. It's not common to see. You may not get it in an exam. But in this condition, when the person is walking, the knee is flexed, the hip is externally rotated, and the hip is adducted. Okay, so you're trying to lift your leg sideways to move and walk, but it is something you get when you have inflammation of the psoas bursa. Okay, you have a gluteus maximus gait, which is basically the gluteus is not allowing you to move forward. So therefore, what is going to happen is your heel strike will change. It will become a lot more posterior than normal. You have to draw a line to find that out. But it is causing the hip to go back rather than go forward. And therefore, it is a very peculiar gait. You may not see it in the exam, but you just need to understand what is happening, okay? So what's a gluteus medius gait then?
Tenderbar gait.
Yeah, what is it? Describe it.
It is due to the weakness in abductors.
So what happens then?
Then
This is the commonest gait you will see in the exam. Okay, so what happens then?
When patient stands on the affected side, the normal side swing down, and he cannot support the.
So what does the gluteus medius do when you're in the stance phase? It will contract to allow the leg to clear on the opposite side. Yes?
Yes.
Yes, sir.
So when the gluteus medius is not working, it's not working because you have a painful hip, you have an arthritic hip, you have infection, whatever it is, it will not work. And when it's not working, the other side cannot be lifted up by the gluteus. So what it will do is when you're walking, you are lifting your body towards the side of the abnormal hip. And therefore the leg is then pulled off the ground so you can have leg clearance and walk. Okay?
Yes, sir. It is clear.
Okay, and if you have both hips in trouble, then what happens? Then you have what is called a waddling gait or a dug gait. Yeah.
Waddling gait.
Yeah. So in this patient, the patient is trying to lift his leg off to one side, and then he goes to the other side to lift it off the other side. Yeah. Okay. So what's a quadricep gait is when the knee is tight. Okay. And for that to happen, you can either have an equinus foot gait, or you can have a gait where you're actually moving the whole body forward and the knee is going back instead of going straight down to land. Okay, these are very abnormal gaits that you will not see in the exam. The commonest one you get is the intalgic gait, and you will get the Trendelenburg gait.
Trendelenburg gait.
Yeah. So this is what a quadriceps gait looks like. The patient has a fully extended knee, and he has to lift it off the ground by hiking it, moving to one side or to the other side. But they have a very straight, extended knee that they're walking off, which is not normal of the gait. In a normal gait, you have to have the line of forces behind at the trochanter and then in front of it and then go behind again. This is not going to happen in a problematic knee. They will just have a straight knee that they walk with, okay? So again, a geno recurvatum or a knee that has gone in that position is a leg length discrepancy gait, isn't it? They have one leg shorter than the other side, and that's what the gait is going to be. A hemiplegic gait is when one side is not working. You've seen them, and they're walking with a knee in extension and ankle completely and totally flat. Okay, and the hip is also an extension in these patients. Okay, that's a paralytic gait. Okay, what's a foot drop or a slapping gait? So when the common peroneal nerve is not working, the dorsiflexors are weak, right? So when they have an initial contact, it is not in the phases where you have an initial contact and then you have foot going flat and then you have the forces going behind the trochanter and then you have the heel off and you have the toe push off. Like in this,
it is high step gait.
Is what, sorry?
High step gait.
Yeah, so that you lift your leg up and then when it falls, completely falls flat with a slap, and then it doesn't have all the different stages, and then you have to lift your knee to put your leg off it rather than the foot helping you to do it. So you've lost your foot stability, the knee is now helping you to do it, okay? Aquinas gait is a leg length discrepancy gait where you have a leg taller than the other side. So when it's taller than the other side, on the same side, your knee will be flexed to lift it off the ground, and you will use a lot of forces to allow it to do it. It is mostly present in the spastic type of disorders.
Yes,
okay, the neurologic gait is something that is beyond your orthopedics, but it occurs most commonly in Parkinsonism. It occurs in hemiplegia, and then you can see the scissoring gait in the cerebral palsy patients. Yeah.
Yeah.
Okay, so it's a shuffling gait. Basically, you have short steps, short cadence, and you're walking with very little heel strike going on. So the ataxic gait is like a drunken gait. You walk with a broad feet and you don't know where you're walking and you can't have a straight line walk. And these are the people with the ataxic type of cerebral palsy who have it. Basically, if the person is totally uncoordinated, then that means that it's an ataxic gait. Okay.
Sir, what is circumduction gait?
Sorry?
Circumduction gait.
It can be. I don't remember reading it that way, but it is basically totally disorganized. Okay, and it looks like you're drunk. You know, I'm not sure if you've seen a drunk person walk. You see it all the time on the weekend here in England. Like they're totally discoordinated. They have got no coherence, and they walk in a circle. The spastic we've discussed in the gait cycle in cerebral palsy. Basically, both legs are together and they walk like a scissor. Right? They cross the legs while they're walking. Okay. So we've done foot drop. I think we've done and covered all of it. It was a difficult topic, but we have covered it in quite enough for you to remember and get yourself out of trouble. These are all.
Sir, what about stepping gait?
What do you mean by stepping gait?
Stepping.
You tell me the example. Where would you see a stepping gait? We just showed you a high stepping gait. That's when you have a foot drop. I didn't go through this because we've already discussed this on the high foot drop, isn't it?
Mm.
So the initial contact in the high stepping gait is not the heel but the big toe. That's the difference. The big toe touches the ground and it slaps onto the ground and it gets going. Okay, so this I will keep here for a minute, or you can have it on your video. But these are all the YouTube sites where all these gaits are shown to you visually how the gaits are done. Right. If you want to know more about the gait, you need to go onto those sites and see what it says. Yeah.
Yes, sir.
Yes.
Basically, there's not a lot difficulty to understand the gait. You need to understand the swing phase, the stance phase, the different components of it. You need to understand all the 4 or 5 definitions, the 5 different phases of the stance phase, and the 3 phases of the swing phase. And when you know that, you need to know 3 or 4 abnormal gaits, such as the painful antalgic gait, the Trendelenburg gait, the high stepping gaits in people who have a a common perineal palsy. These are the 2 or 3 gaits you will actually see in the exam. So if you can describe these gaits, then the examiner most probably will ask you to describe the gait cycle, and we have discussed it quite detailed. You can always revise this, and then you can survive this exam if somebody asks you gaits.
Yes, sir.
Okay?
Right, sir. It is clear, sir. Very much simplified.
Okay, so what time is it now? It's 3 o'clock, isn't it? In a couple of hours,
Yeah.
we will come back again. You all go and have a chill out, have a nice cup of tea, meet your families, do talk. You must always learn how to relax in the exam. You know, you can't burn out before the exam. So family time is very important. Spend a lot of time with your family. Okay, so I will leave you today. I will hopefully give you the videos, and then I'll come back later in the evening, and we'll get Sufyan and Kazim to teach you about soft tissue knees, and I can just stay there. And if I have to add anything, which will be very little, I will add on to it. We happy?
Yes, sir. Thank you
Yes, sir.
so much, sir. So nice.
So nice of you, sir.
At which time, sir, will return?
9 o'clock Pakistan time.
Okay, sir. Okay, thank you.
Okay, this is for soft tissue knees. Yeah.
Yeah.
Yes.